Hello, this is Dr. Clark, and what I want to talk to you about now are carbohydrate blockers. Okay, carbohydrate blockers are also out there. You'll see them on the internet. There's lots of things advertised. And can they be helpful in a weight loss plan? Well, the shorter answer is potentially yes, it can. Carb blockers are an extract of white kidney beans, and what they do is they'll actually block the enzyme amylase along your intestinal tract. And by blocking or inhibiting the enzyme amylase, you won't absorb quite as much carbohydrate. When you're on a fairly low carbohydrate diet, it can actually work fairly well. It can block about 1/3 of your carbohydrate intake. And by doing that, you've done a couple of things. The first is that you've taken in less calories. You're not absorbing some of those calories. But the second thing is, and which may be even more helpful, is you're taking in less carbohydrate. And if you're taking in less carbohydrate, you can influence some hormones, specifically insulin. We've talked about it before. If you can decrease your insulin levels, it's easier to lose weight. You can mobilize fat much easier. And what I want to talk about now is kind of some extra benefits of carbohydrate blocker. We mentioned that carbohydrate blockers can block about 25 to 33% of the carbohydrate intake that you have. Well, if you think about it, what is a fiber? A fiber is non-absorbed carbohydrate. So now if you've taken a carbohydrate blocker and you're blocking some of the normally absorbed carbohydrate, you've made it into a non-absorbed carbohydrate, which makes it very similar to a fiber. So it can actually be helpful as almost a fiber supplement as well. And you can get some of the benefits from a carbohydrate blocker that you would get from taking extra fiber. So you see, carbohydrate blocker not only may help you decrease your carbohydrate absorption and decrease your calorie absorption, but it may actually kind of increase your fiber absorption without physically taking more fiber. Remember, it's your life. Make it a healthy one.